Hello, my name is Chan Hellman, and I'm a professor at the University of Oklahoma and have been studying hope for about the last 12 years. I've really spent the last 3 or 4 years trying to develop curriculum and strategies on how to nurture hope. I'm especially interested in working with individuals who are experiencing trauma and adversity or who come from that background. I'm in particular interested in how we can begin to nurture hope among individuals who have had a little bit of crisis and adversity in their life. And so I'm really honored to be able to present some of this work to you in the context of education. I'm a first generation college student as a professor at the University of Oklahoma. Much of my early research was focused on looking at academic indicators of success for first generation college students and really students who are traditionally considered at risk. So I have a long history of working in this area of hope. I do work and advise many different school districts on creating a culture of hope within their schools, within their school districts. And so, again, I'm really honored to have the opportunity to share some of that information with you today. So, I'm going to pull up my PowerPoint and we'll begin the conversation. So, as I mentioned, I'm from the University of Oklahoma. I'm a psychologist by training. In fact, I'm a quantitative psychologist by training, which means that my area of research is in statistics, research methods, and the philosophy of science. At the University of Oklahoma, I teach in the School of Social Work. And this is where I also lead the Hope Research Center. In the Hope Research Center, we are specifically interested in how to create strategies or environments that nurture hope. Overall, what we have found is that when we're able to nurture hope in children and adults, it leads to positive outcomes. When we increase hope, it tends to buffer adversity and stress. And more importantly, what I'll share with you today is that hope is something that can be taught. So, historically, in practice as a psychologist or in the work that you do, think about the way that we typically frame this work when we're working with individuals. It's because we're trying to make sure that we can identify some potential deficiencies that they may be experiencing or that they may be at risk for some negative consequence like uh, poor grades or retention or things of that nature. And as a psychologist, what I learned is that I had spent my entire professional life being focused on this question of trying to understand what is wrong with you. If I can understand what is wrong with you and to find strategies to reduce those deficits, that was my job leading towards well being. That is, well being is viewed as the reduction of whatever adversity you may be experiencing, whether that's depression, externalizing behavior, disengagement, etc. Now, most of my work is in this context of adversity and trauma. And so I'm just going to lay a little bit of groundwork. I do think that this is particularly important because we're becoming more and more aware that students who are transitioning into high schools and universities are traditionally coming from, or more and more coming from, a background where they've had some adverse experiences. So I really want to ground this work of when we think about hope is working with individuals who have had some struggles in their life. Now, this work has helped shift the question from what is wrong with you to a more trauma-informed framework of what has happened to you. That is, we transition from well-being as a reduction of adversity to this idea of well-being as a student-centered approach. Most of you are likely familiar with the adverse childhood experiences. And the adverse childhood experiences is based upon these 10 categories. The idea is that if you have experienced any one of these adversities before the age of 18, that you would give yourself a score of a 1. Therefore, an ACE score or adverse childhood experiences score ranges from a 0 to a 10. The higher the score, the higher the level of adversity. Now, in the United States, the Center for Disease Control does a national scan, an environmental scan of the prevalence of adverse childhood experiences in the United States. And some of the key findings are that about 36% of the population have an A score of 0. We also know from this research that there's this dosage effect or cumulative effect. That is, the more adversities that you've experienced before the age of 18, the higher the likelihood of difficulties across the lifespan, whether that is in, excuse me, in risk-taking behaviors, smoking, drinking, binge drinking on campus, etc. And we can see that about 12 to 13% of the population have an A score of 4 or higher. Again, A scores range from 0 to 10. At the national level, the average A score is a 1.61. One of the reasons I want to highlight this is because in Oklahoma, where I'm from, Oklahoma ranks #1 in the nation in the number of youth with A scores of 3 or higher. And so what we've become interested in is how do we work with schools and universities in working with these youth who have had these difficulties, because they're also much more likely to experience difficulties in classroom behaviors, difficulties outside the classroom that influence their capacity to thrive academically. So as I mentioned, most of my work has been focused in this area. And so, for instance, I do the national research on children exposed to domestic violence. So we study youth, school-age youth from 22 states. And the average A score for these youth is a 4.4. That is, out of 10, they've had more than 4 of those adversities. Juvenile offenders, youth who have been adjudicated, also tend to have this high trauma background. And by the way, one of the things that we know is that if you have an elevated A score, your ability to navigate classroom behaviors become much more difficult. I do the research in the state of Oklahoma for all foster youth. And so we are creating a culture of hope. We are training all foster child welfare workers and partner agencies in the science of hope. The basic idea is how do we create a culture of hope that nurtures this idea for foster youth? And you can see that foster youth who are aging out of the Oklahoma system have a tremendous childhood adversity score. I want to also point out that in the state of Oklahoma, the average number of placements for foster youth as they're aging out of the system, the average number of placements in Oklahoma is 15. They've been to 15 different homes before they age out of the system. So almost all of my work has been grounded in how do we respond to these adversities so that we can begin to nurture hope. And many of you are likely familiar with the idea of trauma-informed care. It's very familiar, it's growing in its awareness across the United States. And as you know, this is a framework that helps us recognize and understand the effects of trauma on help seeking. So as youth are transitioning into colleges and university and post-secondary activities, how does this history of trauma influence their ability to seek help? And so it's not that we advocate that everybody should be measuring the adverse childhood experiences. What I want us to really think about is how does that show up? How does that history of trauma show up in the youth that you work with? And so, for instance, we've published research that shows that young adults who have an elevated A score have lower levels of trust in professionals, individuals like you. And so when a youth doesn't trust you from the beginning, how does that influence the way they communicate and engage with your programs, let alone with the academic process? We also want to recognize that this trauma-informed care is not just about clients, but it's also about your well-being and the work that you do. What are the frameworks that help you manage your own self-care? And the reason I bring that up is because we believe that hope is an important component, not only for youth, but also for you in the work that you do. So we've created this curriculum framework, these training and workshops that we now do that are grounded in this idea of hope-centered and trauma-informed. So what is hope? What do we mean by this language? And what I'd like for you to do is take just a second and reflect on that word. What does that mean to you? What are some words that come to mind when you hear the word hope? The second thing I would ask you to do is to think about whether or not hope is a way of thinking, or is it an emotion? Is it a feeling that we have relative to the future? And what I would tell you is we define hope as the belief that your future will be better than today and that you have the power to make it so. So we think of hope, we treat hope as a way of thinking. And the reason that that is so important is because it is a thought process, we can teach it. We know how to teach hope. The basic idea with this definition is that it helps us differentiate hope from things like self-efficacy and optimism. So for instance, if we just said hope is the belief that your future will be better than today, that's optimism. It's the last part of that definition that distinguishes hope from both self-efficacy as well as optimism. This idea that you have the power to make it so suggests that hope is about taking action to pursue your future. So what do we mean by hope? Hope is grounded in three simple ideas. First, each and every one of us, from the moment we wake up until the moment we go to bed, are pursuing goals in our life. Goals become the cornerstone of our ability to hope. So in order to be considered hopeful, we have to have the ability to have pathways thinking. This is our ability to identify the roadmaps or the mental strategies of how we're going to get there from here. What is our ability to identify those pathways? What is our ability to imagine the potential barriers we may experience and to begin the problem-solving process before we get there? And then finally, agency. Now, I prefer to use the word willpower, but either way works. Willpower is basically the mental energy that we have to generate the motivation to not only pursue the pathways, but to sustain the pathways. So hope is about goals, pathways, and willpower. Now, some of the things that we've learned about hope in the context of trauma and adversity, for instance, is that individuals who have a long history of trauma, or individuals who are currently experiencing crisis and adversity, are more likely to set goals that are avoidant in nature. That is, I set goals of things that I do not want to occur. Now, alternatively, higher hope individuals tend to set achievement-oriented goals. We've also learned that individuals from these adverse, difficult past are much better at short-term goal setting than they are long-term setting. So it's the nature of the goals that become important in the way that we begin to think about pathways. Let me give you a quick example. I was homeless from 8th grade throughout my high school years. So I spent a lot of time couch surfing, a lot of time sleeping outdoors, and just being homeless in that context. Now, school for me, high school, was a safe place. It was where I could get a meal. It's where I could take a shower. But it was also an environment that I was relatively safe, at least during the day. When I graduated high school, I was faced with this dilemma of what the future could hold for me. And I realized that for the first time in many years, I had to think beyond tomorrow, where I was going to sleep, where I was going to eat, that kind of thing. So I started to imagine my possible uh, future. And what I came up with was that I could work as a local laborer, I could work at the local prison, I could join the military, or I could go to college. Now, I chose going to college, not to achieve a college degree, but to avoid the other options. My first semester grade point average as a college student was a 0.56. And in Oklahoma, what that means is that I failed every class, but I did get a B in advanced swimming and life saving. So I did enjoy that course. Obviously, the university asked me to step away for a while and to sort of gather my thoughts, and the rest for me is history. But the reason I point that out is because going to college for me was a way to avoid the other possibilities. That is, going to class, studying for exams, those kinds of things were not pathways to the goal that I had set. Yeah, I wasn't there to achieve a college degree. We've also learned that individuals who have faced adversity really struggle with the pathways piece, these strategies by which to attain our goals. Higher hope individuals are much better at this process. And then finally, what I would talk about with regards to willpower, two things. First of all, our willpower is finite. There's only so much mental energy that we have from day to day. We wake up with some energy, but by the end of the day, we've depleted that willpower. And what I would like to tell you is that when we deplete our willpower, we also start to lose the capacity for self-control. Our ability to self-regulate our learning becomes much more difficult when that willpower is decreased. So what the research shows is that our willpower is connected to the glucose in our system. And glucose for us is energy. So the big takeaway here is that nutrition matters. One of the things that we have learned from foster youth who have aged out of the system is that they really appreciate when their counselors, school counselors or others, had snacks, because rarely did they have permission to eat snacks at whatever home they were staying in. So nutrition becomes an important part of hope. Goals, pathways, willpower. We have to have both willpower and way power to be considered hopeful. That is, I can be highly motivated for a goal, but if I don't have the pathways to get there, I don't know how to get there from here, I would be considered lower in hope. Now, alternatively, it may be that the pathways are available to me, I'm just not motivated to do that. So during my first semester as a college student, the pathways were there. There were many different programs available for student success. I was a first generation college student, so the university had programs, it had pathways for me. I just was not motivated to do that work. So goals, pathways, and willpower. Now, what I would like for you to consider in this language is that your programs are indeed pathways of hope for the students that you serve. Your programs have goals, your programs are the pathways. Each and every one of you are a pathway for the students that you work with. The hard part is getting those students motivated to do that work to achieve those goals. Now that we know goals, pathways, and willpower, these basic tenets of hope, what I'd like for you to do is just think for a few moments about how often we use the word hope in our everyday language. I hope you're well. I hope you have a great day. I hope it doesn't rain today. And being from Oklahoma, we'll often say things like, I hope there are no tornadoes today. So what I'd like for you to see is that we're using this word hope not so much in this way of goals, pathways, and willpower, but more often than not, we use the word hope when what we really mean is a wish. And so when we have a wish, we have the desire for the goal. I wish it wouldn't rain today. I wish you were well. But if I think about the idea of I hope it doesn't rain today, I have the desire, but I don't have the pathways. I have no control over that. So we have to make sure we understand the distinction between a hope and a wish. Hope is about taking action to pursue your goals. Now, there are roughly 2,000 published studies on hope, the way that I'm talking about it. I'm going to focus only on the education research that's out there, the published research on that. And first of all, what we know is that across the 2,000 published studies, hope becomes one of the single best predictors of well-being for both children, adolescents, adults, and later in life. Now, within college, what we have found is that a child's hope scores are a better predictor of first-year college performance than the ACT, SAT, or high school GPA. Hope outperforms standardized testing, even when controlling for social and economic status and IQ. It is a better predictor. Students with higher hope have better attendance, better retention. It predicts which courses they select because the electives become pathways to the goals that they set. Higher hope students have higher grades and higher graduation rates. The research here is quite clear. Now, I'd like for you each to imagine this idea of experiencing goals, pathways, and willpower, this idea of nurturing hope together. So let's use as a hypothetical example this idea of driving a stick shift car, a manual shift transmission. So our goal is to drive. Our pathway is that we have to manage a stick shift car. Now there's going to be about 3 or 4 really important takeaways on this slide. So this is the one I really want you to lean into. So first of all, there's some of you who have never driven a stick shift car or who don't know how to do that. And so here's what I'd ask you. Can you imagine yourself sitting in the driver's seat for the first time and about to drive a stick shift car? Can you picture the 3 pedals on the floor? Can you imagine trying to have to figure out the stick shift pattern? And so those of you who can picture yourself in that framework have demonstrated the first important takeaway for hope. That is that imagination is the instrument of hope. We have to be able to imagine ourselves pursuing something and achieving something in order to nurture hope. So for the rest of us who've attempted to drive a stick shift car, what I'd like for you to do is remember that very first experience. So we've got the car started, we've got the clutch depressed, we're in first gear, and as we're letting that clutch out for the very first time, what I want you to remember is what was your goal in that moment? And most of the time we'll say not to stall the car, not to kill the car. What I'll point out is that's an avoidant goal. When we are in moments of stress and adversity, we are more likely to set an avoidant goal. So let's say we let the clutch out and in fact we stall the car, we kill the engine. What I'd like for you to ask yourself is, remember, what was the self-talk going through your mind? And more times than not, people will say, I can't do this. I'll never be able to do this. Now, individuals who come from these adverse environments, and I can imagine a first-generation college student who has that first failed attempt is filled with the I can'ts. I can't do this. So here's the next big takeaway. For those of you who drive a stick shift car, can drive or have driven, is why didn't you give up? Why didn't you quit? And here's what we found. The more we desire the goal, the more we're going to face adversity to try to overcome it. We're going to face that adversity. We're going to still try to make it happen. And so that's the second big takeaway. So we've got the car started. We're still in first gear. We let the clutch out and now we lurch forward. We're actually driving. We have a successful attempt. Third time that we start the car and let the clutch out, we kill the engine again. But I want you to notice the difference this time in the self-talk. Because we had that moment of success, now our self-talk becomes, I can do this. I've done this before. And here's the takeaway. Hope begets hope. Because having that one opportunity for success made the future possible. It made it possible, and I can do this. So this is the idea of hope begets hope. So pretty soon we're able to drive the car. But here's the question. How well can you manage your willpower? How well can you manage and focus your attention during this pathway pursuit? And here's what I would argue is that each and every one of you, your programs are pathways to the goals. But I think that more often than not, we make the assumption that the students or clients have the ability to dedicate all of that willpower, all of that attention to these programs. Now, remember, willpower is finite, and there's more of our life that is going on than just your program. So, for instance, if I'm a foster youth and I'm trying to go through school, I'm also trying to navigate work. I'm also trying to navigate housing, other issues that are detracting my ability to focus my attention. And here's the final thing that we've learned is that unmitigated trauma is not an attention detractor, it's a hope robber. So when somebody triggers or they experience crisis and trauma, their ability to focus on the pathways become almost impossible because they're in chaos. So we have to think about what are strategies that we have to help settle that chaos, like mindfulness practices, for instance. So this is the interplay between goals, pathways, and willpower. Now, just as a demonstration about attention and this willpower that I'm talking about, what I'd like for you to do, each of you listening, is to just close your eyes for a second and just let your mind wander. And I'm just going to let you set for a few seconds and I'll bring us back. Okay, so what I'd ask you is as your mind was wandering, and obviously I didn't give you very much time, but where was your mind? Where did you wander to? And what the research shows is that most of us tend to think about the future. What do we have to do today? What's coming up? Or perhaps we were reflecting on the past, something that's happened, something that happened this morning or yesterday, for instance. Now, what our research is showing, the research we're doing at the Hope Research Center, recognizes that where our imagination is, where our attention is, future or past, can be either positive or negative. And here's what we found, that individuals with a history of trauma and adversity are much more likely to be focused on the negative aspects. That is, they think about the future with worry and fear, or they're stuck in the past with this idea of rumination, regret, guilt, and shame. And as a result, they're much more likely to experience suffering, more negative emotions. They engage in maladaptive coping strategies like partying to help self-medicate through those things. What we want to do is find ways to interrupt those negative rumination and worry so that individuals have the capacity to hope, to begin to think about the future with its possibilities. Because what we find is that higher scores in hope reflect higher levels of flourishing. And this is really the essence of our research, is how do we interrupt rumination, regret, shame, and guilt so that individuals can thrive. So I'll ask you now, what is the opposite of hope? In your experience, when you think about what the opposite of hope might be, what comes to mind? And more often than not, what I hear is despair. That is the typical response that I get. But what I'd like for you to understand is that you're wrong. It's not despair, it's apathy. Now, apathy is when I've given up. Apathy is when let's say that you come to me and you say, if you would just study, if you would just join a tutor group or study group, or if you'd work with all of these different pathways that are available. When I'm in an apathy mode, my framework is it doesn't matter what I do, I'm going to fail. So why try? There's just no reason to try anymore. I'm giving up. That's the opposite of hope. Despair is when we still desire the goal. It's just that our pathways are all blocked. Now, what happens in despair is time becomes very urgent. We have to find a solution right now. And despair leads to desperation. And desperation leads to, more often than not, very dysfunctional pathways. cheating on an exam, for instance. Now, what I'd like to also show you is the connection between hope and depression. And this is from the Healthy Youth Survey from the state of Washington. And what we find is that we're able to categorize students into no or low hope, different categories all the way up to high hope. What we find is that the no or low hope group has a much higher prevalence of depression. So you can see that roughly 70% of the youth who report no or low hope are also experiencing depression. A similar pattern is available for suicidal ideation, anxiety, and on and on and on. We see this same pattern over and over. The good news is that we know how to teach hope, and I've dedicated the last 10 years of my life in working with those individuals who are experiencing despair and apathy so that they can move towards hope. We know how to do this process. It starts with goal setting, finding the pathways, the viable pathways. And then once you create that goal and the viable pathways, we highly recommend spending time on creating future memories of success. What will success look like? When you graduate from college, what will that look like? What will that feel like? How is your life going to change? Those are some of the activities. Now, as an example, I do research on youth exposed to domestic violence. And this includes high school age youth. But these are the high trauma exposed individuals with a really high ACE score. And so you can see that these youth have experienced tremendous adversity. 80% witnessed domestic violence, almost 45% incarcerated parent, and you can see the other categories, just a high trauma group of kids. Now, this 1-week camp is actually led by camp counselors. It's a non-therapeutic intervention. We've trained them on this language of hope and the idea of goal setting and pathways development. I will tell you that the camp counselors are typically 18, 19, and 20-year-old college students who are actually running Camp Hope for these youth. We measure hope 30 days before camp, the last night of camp, and a 30-day follow-up. And we see a statistically significant increase in these trauma-exposed youth in their hope scores. Now, here's what I want to point out, is if you notice the difference between the pre-test score and the post-test score, for instance, that's roughly 2 points. What's impressive is that 2-point change, 2-point increase, actually predicts a letter grade change in the classroom. Nurturing hope leads to these positive outcomes. We know how to do this process. We know how to nurture hope. Our research has spent, again, the last 5 years building this curriculum, trying to understand these strategies. We now have worksheets that are available on my website, chanhellman.com, these worksheets. And what we found is that we can show a statistically significant improvement in a youth's hope scores in 1 hour or less. In 1 hour or less, using this process, you can move the needle. Hope is one of the single best predictors of well-being, and it predicts these academic achievement indicators. So as I conclude in the presentation today, what I want to highlight is that at the heart of change is our ability to understand the way things are right now in our life. If I'm experiencing a lot of adversity, that I can understand the way things are right now in my life, and I begin to imagine the way things could be. If I can lean into this idea of imagining what that future could look like, that is where hope is born. Thank you for inviting me to speak to you today. I hope you have had a great conference, and what an honor it's been for me. Thank you.